Here, you can see that is the carotid, the external and internal carotids later on you see. These are the veins that drain the blood down back to the heart. The red one is where the blood is coming up. So most of the time they tell us that on the superficial part of the bodies, usually it's not the artery that is in trouble. Okay, the veins. The blood that comes back to the body is obstructed. But if it is to the brain and to the heart, many times the carotid arteries, the one that brings blood up to the brain, and the coronary arteries that go around the heart. And you know nowadays strokes are so common. Heart attacks are so common. So that's why it's so nice to be able to understand this and how we can prevent those obstructions that can be deadly to us. Okay, move on. If you look at this one, there is a place called the carotid bulb. Okay, I want to mention about this bulb here, the carotid bulb. You see that it is almost the level of the chin, just below the level of the chin, is somewhere here. Now, if you put your fingers there to give a massage on the neck, be very careful of this carotid bulb. Because this bulb is very easily influenced by the pressure you put on it. If you massage that area, it tells the brain that the pressure is too high and it will lower and lower the blood pressure to the point, severely, okay, to the point that the blood supply to the brain can be so little and you can end up in a stroke. Now, sometimes we always think that stroke is because of high blood pressure. But I want to tell you that normal people can also have a stroke. But the incidences is much lower. Okay? But you can also have a stroke when the blood supply is too low. Okay, so low that you can have a stroke too. Okay, but for most of us, that is also uncommon. But high blood pressure is. So when you put if you ever put your fingers over here to give somebody a massage, make sure you do not go so deep and you are massaging that carotid sinus. Okay, this is the carotid sinus. This is a bifurcation of these two arteries, the internal and the external carotid arteries. Because if you put your finger there too long and you affect it, the blood pressure of that person will go down and he can be fast asleep and lose consciousness. I know sometimes when you massage some people and things like that, the fellow goes to sleep, then you say, wow, he really enjoyed it, and massaging, he is sleeping. But also be careful. Okay? I want you to treat people, but not kill people. Okay, I hope you know what I mean. Okay, I must tell you. You can kill a person by massaging that carotid sinus, and that person will die. And when anybody wants to check how that person dies, they will not find a reason. But that's massaging that. Because the blood pressure will go down and down and down, and finally the heart will stop.
That's why when some women ask,
if they hold the neck, if a criminal holds the neck and wants to choke you, but during the study, the higher bone will be broken because they will grab you so hard and they will break that bone, the highest bone. This bone is not attached to any other bone, but this is only for the movement of our tongue and swallowing, or when we vomit. But remember that carotid bulb, I make it very clear to you. If you put your hands here, you want to massage people on both sides. Do not go deep, because if you go deep,
Slowly.
you are touching the carotid sinus. CAROTIDSINUS. Okay, so I don't make a mistake, please. Because there are some women who are killed by men, supposed to be the lovers. And when they are lying in bed, they will just massage her, and she will go to sleep, and she will not wake up. Her heart stops. And when they come, they find that there is no sign of criminality, and they cannot find the criminal. And he can say, I did not kill her because we just massage her like that, no black mark, no nothing, no broken bone, no nothing, no injury at all. Okay, so I mentioned that to you so that we will not make a mistake. This is for sure. So these are the big blood vessels, but very important. They supply blood to the brain. You know, our brain, when the blood supply is not there, we call ischemia. And then, as I said, you continue that condition, the heart will stop. Okay, the heartbeat will drop, the pressure will drop. Okay, at first the heart will go faster and faster, but it's weaker and weaker, and the person will fall asleep and die. Not only fall asleep. Okay. Oh, sorry. Okay, we are back. So these are the techniques that I show the therapies. So the purpose is improving circulation to enhance healing. Okay, that is really our purpose. To enhance circulation, to improve circulation, to enhance healing. Okay, next. So now we go down from the neck, we go down to the arm side. So these are the important veins. If you see the veins coming down, the blood, the carotids come down, you see the return flow goes all the way up, back. And then finally you reach the superior vena cava. From the superior vena cava, it enters the heart. So when we massage the hand, we do treatment on the hand, these are areas where we need to work. So one of the main areas you can see here, and under the armpit is here. The big blood vessels pass by. So what we want to do is to improve the circulation, allow the blood to go back on time and not delay. Because when there is delay, it will cause ischemia to the tissues in the arm and so on. And a lot of joint pains and things like that is because of poor circulation. So when you improve the circulation, who are the people who have poor circulation in the arms and legs and so on? Can you name one disease? Huh? Sorry?
High blood.
High blood pressure?
Stroke.
Maybe not. High blood pressure.
Stroke.
Yeah, stroke. Stroke, of course, is to the brain. Yeah. Who are the people who later on they cut off the leg and cut off the feet, cut off the legs and things like that? Diabetic. The diabetes. Those who have diabetes. Why? Because the food they eat, the sugar is clogging up the supply of blood. So in the end, you see the toes turn black, the toes die, and they have to cut off the leg.
Amputation.
Amputation, that's the word. Amputation. So amputation below the knee, anywhere down here is below the knee. And the other one is above the knee. Above the knee is some of the worst. When I was in Bacolod City, I attended with Dr. Devilla. We were taking care of a diabetic patient. He came with his toes black. And Dr. Devilla said, we have to do amputation. So I asked him what level. He said, I can't tell you what level. When we do the operation, we will know where. So So I said the toes are only looking dead, turn black already, you know. You call necrosis. The word necrotic or necrosis means death. D-E-A-T-H. Yeah, that word is a very interesting word. You know. I wish I have a blackboard, I will write it up for you. Okay, those of you who have ball pen, can you write the word E-A-T? Eat. You just write the word E-A-T. Yeah.
E-A-T.
Yeah. E-A-T. You put a letter D in front and you put a letter H at the back. You see what it is?
Death. Death.
Death na.
Sa kaon na yun.
So sa pagkaon,
So a lot of deaths happen because of what's that? Food. Eating. In English, I don't know whether the spelling is by accident or by what. Just the word eat. You put D in front and you put H at the back. Word lang.
Death.
patay na.
Does it make you think back to the Garden of Eden when God told Adam and Eve, there's a tree
Hindi
you do not eat. If you eat, you
Die. Surely die.
Surely die. Surely you will die.
So sometimes you wonder whether that kind of thing, you know, the spelling of one word can tell a story. Okay, so look at that, right? The circulation here is very important. That's why later on when I show you the techniques, we grab people under the armpit. Of course, some people feel very below, yeah. But then we need to massage those veins because they are passing by here and then down here. Very important. I'll show you later on. Okay. Sorry.
Habang ito si Sam.
Mga tikulang yun.
Shut down.
Kaya nagaling ang tingin ko.
Tigulan na.
Sometimes my hands go faster than my head. You know, like sometimes you talk faster than your mind.
What happened? I feel pain. Because I
Okay.
Pressure.
Eating.
No. Tidbits, you look at tidbits. I think over. Over this. Now over this side. Go up, go down. Go down.
Touch it.
Tidbits again. Tidbits for tidbits. Sorry about that.
Side brain, slide brain.
Okay.
Mitchell.
So on this slide, you see the medial nerve and the ulnar nerve. So these are the two nerves, and then the other one is called the radial nerve. So there are three nerves there who go over the arm side. So as I said, those muscles in your heart also have an idea what nerves what do you call that? What is the nerve supply? We call it that. So there are three of them. The one that you many times know is the ulnar nerve, the one that passes through here. Sometimes when you do something and you hit that nerve and you feel numbness, over this finger, and half of this middle finger. That is served by the ulnar nerve. The radial nerve serves the thumb. The first finger, the thumb, what do you call this? Index finger, right? And then half of this, the top side of this middle finger. So this, the ulnar nerve and the radial nerve, they serve all the feelings of your fingers, all the 5 fingers. So as I said, sometimes you make a mistake, and like you hit the edge of the table or anything, right, then you feel that numbness. Actually, you know where it passes, right? If you put your thumb here, you see here, like that, and then you kick medially this side. Can you feel that? The numbness? Yeah. That's the one. This finger, this finger, and half of this finger. You can feel it. Yeah. That's the ulnar nerve. Okay. So when sometimes people complain of finger joint pains and things like that, right? Or what do you call that? Trigger finger and these things like that. So you know which nerve is involved, whether the ulnar nerve or the radial nerve and things like that. Okay. That is as far as the nerve is concerned. So I have an idea. I think it's quite a lot. So as I said, all of these past 2 years, pump it. All of this. This is a very important area. Okay, very important area. A while ago, I think I mentioned to you about diabetic foot. Now that man, he already lost one leg. Lost one leg above the knee amputation. But this time, 2 years later, because he did not correct his habit, his eating style and things like that. So now 2 years later, he's back with the other foot. So I told Dr. De Villa, he told me probably it is above the knee amputation. And he said, we'll try to make the two thighs just as long as each other, and not one shorter than the other, because it's nicer to see when they are so the same. So he said, I will show you when we need to amputate. So we started the blood vessels from the foot. We tested all the arteries, all the way going up. As you go up, the artery is bigger and bigger, right? So as it goes up, we find that all the blood vessels, to try, we take a thread, the one for surgery, we tie it, and the moment we pull, the blood vessel will break. And if you tie the blood vessel and the blood vessel will break, it will bleed. So you need to go higher. Finally, we go from the lower leg, past the knee, and higher up. And everywhere we tie the thread, the blood vessel broke. So you cannot have a broken blood vessel because the patient will bleed to death. So we need to go up higher and higher until we find the blood vessel where we tie will not break. And those blood vessels, even though they are bigger, but the clogging inside the blood vessel is so thick that little blood is coming, even in the big blood vessel. So in the end, finally, we thought maybe we cannot do anything but tell this patient to go home. And we can't do anything. Because if the amputation goes higher than your thigh, you cannot do that. And we know that the damage of the blood vessel goes even higher up to the trunk of the body. And we can't do anything. The patient would have to go home and die. But when we finished that day, this leg that 2 years ago is longer than the one that we amputated. So this leg was so much shorter. But thank God that we can still do the amputation. If not, he will be hopeless. Well, I still remember that patient very well. When we everything is stabilized. We took him out of the operating room. And I tell you, he looked at his leg. Now, no more legs. And the way that his leg is wrapped up is shorter than even the other one. I tell you, he cried like a baby. You know, some of this, my experience in the hospital, sometimes can be very emotional. You know, you feel sorry for him, I tell you. You know, how did he live his life that he has to lose 2 legs? I tell you, to be broken-hearted at that time, it's too late. That's why I always consider, if we can prevent it, make sure we sacrifice if we need to prevent it from happening. Because when it happens, the tears does not solve the problem anymore. No matter how many tears or how much tears or how many bottles of tears you have, it won't solve the problem. So, with my few years in the medical field, I guess prevention is better than
Cure.
cure. So let's go down to the leg side. So you see, this is a very important area, right here, the groin area, this area, and then further down is the popliteal area down here, this part here, and the rest you can see the blood vessels, right? They're all bringing the blood back to the body. This is some of the longest, much longer than the arms. So you know very well when this circulation is no good, varicosis, you know what they call varicose veins? And so many people have that, especially the city people. Those patients that come to Anan, those city people, men and women, varicosis is so prominent. And sometimes they are complaining, my legs are so tired. Why? Because of poor circulation. And by the time they come, sometimes the varicosis is so big already. And it is so tortuous, It is winding left and right, up and down even. It shouldn't be that way. If they are healthy, you see that they go up straight. They are not healthy. And so sometimes a lot of help that we give amounts to so little. Why? Because the condition is already so bad. Yeah. So sometimes we feel so sorry for the person, and yet the person does not even know that he is having the problem. So that's why I really like to educate and talk about it. It's not because I know so much, but I feel it so necessary to see people aware, knowledgeable, to be able to take care of themselves. Because all of these problems, you are the first to observe, first to know. Nobody else knows it more than you. You are the one. And if you yourself do not know, then when are you going to get help? So ignorance, you pay a price for your ignorance. Yeah, you can see more of that, right? So all of these ways coming back, you see here they come this way. This is going back up. This is going back up. So you can see this, the saphenous vein, this big fellow, and before it joins the popliteal vein. So when you put your hands on that to move the blood, you remember you are helping this big blood vessel. This big blood vessel, I want to show you, there are valves in it, There are valves in it. Okay, you can see all of them, So I know that to remember those names may not be necessary, but I want you to know that they are there. Okay? And when you put your hands there, whatever you do, you remember you want the blood to go through this. These are the main rivers, so to say, where the blood flows, these veins are. So there is one very important one, this valve here, and there are valves here, Now these valves are very important. So that's why if you are a lecturer, if you are a teacher, when you stand long, you can do is to kick backwards. You can do like that is to kick backwards. When you kick backwards like that, you move this muscle, you squeeze this muscle, and the muscle will move the blood up. So you can do that. I will talk to you about the exercises that you need to do. Okay, you kick backwards. You not kick backwards. You hold your foot up, and then you kick backwards. Yeah. In that case, you pump those muscles will pump the blood back to the body. So if you sit long in an aeroplane, sitting down, like 8 hours to Europe, things like that. That's why they encourage you to stand up and walk. And you stand, hold the seat, and you do back kick in the hallway, you do back kick. You need to do that. You can pump it 5 times per leg. You can pump it 5 times per leg. Because this will prevent the slowing down of the blood flow to get back to the body. Talk more about that maybe. Because this blood flow is very important, when the blood flow is slow, the return blood flow is slow, your blood becomes more and more acidic. You know the word acid? When it becomes more and more acidic, the blood is more and more toxic. So that can cause ischemia to the tissues. And when the blood flow is that bad, the acidity goes up. When the acidity goes up, then the oxygen level is low. And to make things worse, the waste product goes higher and higher. So the waste product in the blood vessels can cause damage to the walls of the blood vessel. And that is where the varicose veins begin. They begin to form. So that's why it's so important to understand this. So if other than that, if you don't want to do back kick, you can walk on your toes for a while. You can walk on your toes. When you walk on your toes, the same thing happens. Okay? Yeah. Like many of us, if you are not used to that, if you walk on your toes, sometimes these muscles will cramp, And like many of us sleeping sometimes, at night, the next morning when we wake up, when we want to move, the cramp.
Biko.
Cramps. Not bicolano, Okay. So this is important, right? So like I said, you stand on your toe, like that. Yeah. So you squeeze these muscles and the blood will go back up. Okay, this is a deep vein, deep in the calf muscle. Alright, so like any one of you, if you develop cramps and nobody to help you, what can you do? If you can pull, like some people even cannot reach the toes, right? What can you do? What you can do is you stand up. Hopefully you can stand up. What you can do is you bend one knee, you go like that, and then you push backward. You see here? This one, you push backward, bend forward. You can do like that. Make sure you put the pressure at the back stretch. So you stretch those things, okay? Yes. You wait until the cramp is over before you release. Because if you release too early, the cramp will come back.
That's right.
So you do that, okay? You can do like that. Push this one, like that. You walk on your toes. You push backwards. You push backwards. The stronger you push, the faster it will repair itself. Recover. If nobody can help you, if you can grab your toes and you pull it out, good. Some people it's so painful. They are like, they cannot help themselves. Yeah. So if your grandma or grandpa have that, you younger people, make sure you get back and put the knee down on the bed. If they are on the bed or on the floor, and then you push the Push this one up. Push your, that we call it dorsiflexion. Dorsiflexion, not plantar flexion. Plantar flexion is down this way. This is dorsiflexion. Yeah. Okay? I mean, some of these medical words, you don't have to know it, but just to tell you. This is what we do. So you can grab your toes and pull up. Yeah. Grab the foot, pull it up. Okay? Or somebody can help you. Yeah.
Like a blanket.
Or power. The tummy is big and you cannot reach your toes. Put up. Okay, let's go to the next one. Now let's look at the lower part of the abdomen. And find that these are the nerves. Okay, these are the nerves. Okay, that supply to the abdomen and things like that. Now, if some of you are good, I will show you some of the movements of some abdomen when people have constipation. What do you do to help? How to help them move the bowel. Yeah, there's a movement. You follow the peristaltic movement. Yeah, you can do that. I hope those of you who know some massage techniques already, you just add to your knowledge what you already know. Okay, so you can use. Alright? Because this is part of that, both the blood supply and the nerve supply. So you find a lot of people have sciatic pains. We will talk about that, we will deal with that. Okay? And I hope we have a real fruitful time. And then I need to talk to you about the exercises that will prevent it from coming back. Okay. Because all the treatment that we give you, okay, all the treatment you give to the person is only good for that moment. If that person does not go home and do the right exercises, within a month or two at the longest, they will go back to the same condition again. So that's why you find that many doctors, they'll give them painkillers and so on and that, and when the painkiller is gone, the patient will develop the same problem. So you go back to see the doctor, and each time the doctor will give you more medication, stronger and stronger, until later on your stomach cannot stand it, your kidneys cannot stand it, your liver cannot stand it. So from one problem, you begin to develop multiple problems. So that is why we are interested for you to not to think of medication first. Think of what can you do for yourself first before you go on medication or go for surgery. Okay. When I teach you some of these things, I don't make money out of you. If you go and see those doctors, every time you go, you have to bring some money. No money, no talk. Money talks. So I'm not talking bad about other doctors, but that is what they know. That's what they do. We know lifestyle medicine, and we are trying to teach you folks to do less damage to the body, okay, and have a more satisfying life rather than depending on tablets, pills, and injections. Okay. So this one I mentioned to you later on. You need to have like pants like mine or jogging pants, because I'm going to show you where you're going to touch, what you're going to do. And if you can, there are no cameras, but you can use your phone. You record some of these movements or things that I do, so you can use it. I have a video actually here that I teach both to the therapists and to the health guests when they come to the center. Because this is so important. There are so many people having pains every day. Pains and aches. Okay. Alright, let's move on to that. So, the mental status that I want to emphasize is, together let us learn and improve our services in the Lord's will. Here you see the bone I want you to see the bone and the nerves that run along the bone side. So from the neck all the way down to your back, down to the sacrum. Okay. You see all of this. So a lot of this, what organs they supply and what is affected. So when you do treatment or a simple massage, you have an idea how many organs actually you are touching. Just going down the back alone. So when you deal with the back, there are many things that can happen. It's not just mere back pain that you are taking care of, but you stimulate and you touch all the organs, because not only the blood supply, but the nerve supply, it stimulates those organs. So this is why this treatment or some of these steps in massage is actually very, very important. And my encouragement is that you use this before you use painkillers, muscle relaxants, go for injections. Okay, you can see a lot of this. So these are the regions called the lumbar region, and people have the most trouble this area. And most of the time people ask you for that. What can you do for me? I have this problem. And many of them have chronic problems, so chronic that they find it more and more difficult to ambulate or to walk around. Okay, the branches of the sympathetic trunk. When you touch the back, you can see that it can affect your heart. This is the sympathetic. Whatever you touch, you know a little bit what organs are affected by the areas that you touch. Not only the area directly, but indirectly, because you are touching the nerves along the back. Okay, can you see all of that? You see all the main organs, from the eyes all the way down to the sex organs. They are all involved. That's why, as I said, when you touch the human body, know a little bit what you are touching. Because a lot of a lot of organs are affected. Okay, you will see as we go along. Okay, you can see that. So for anatomy, we divide it into various parts, the organs involved. So that movement that we do on your back can also improve your circulation, your kidney functions, your digestion. The digestion, stomach digestion, of course your lungs, your breathing, and so on like that, and the heart, and then of course that goes up to the brain. So a lot, okay? So when you touch, you are doing quite a massive work. You see the huge nerves that come down to the back from here to the sciatic nerve going down. And then of course to the front is the pudendal nerve. Okay. So people who have menstrual pain, people who have indigestion, people who have constipation, kidney problems, a lot of these things, it's just a simple touch on the body can help these people. They relieve pain, many times they improve circulation, they improve the functionality of those organs deep inside. That's why sometimes to many people who do not know, they just simply go for a massage. But may I humbly say that there are a lot of people who do massage out there. They do it for do it for a living sometimes. I do not want to be critical of people, but unfortunately, as I said, they don't quite know the reasons why. But they are taught to do it. You know, like you go to you take a boat ride, and there are people sitting there, they are blind, but they are taught to massage, and they do the massage for you. But how much do they know what they are touching when they are massaging? We do not know. I don't know how they are taught, who teach them things like that. But there is always some therapeutic benefits from it. There are some people who will benefit. But what I want to teach you is the exercises that must go along after you give the treatment. That person must be able to talk. That person must be taught the corresponding exercises to prevent going back to square one.
Doc, I
Yes.
think we have to drink water first before we will continue. Yeah, water. Yung uban na 1 hour na kami, mapaka.
Inom tubig.
Okay.
Water.
Yeah.
You have your water also? Right there.
Oh,
That's your water.
thank you. Thank you.
Katong uban, pwede mag-inom ng tubig. Tubig. Water break.
Break, water break.
Water break, olive break.